So on this day of celebration, we're honored to provide the class of 2022 their first full-length white coat, signifying they're no longer students, but practicing clinicians. We applaud and celebrate the last 27 months of hard work, and you'll get a glimpse of that and highlights as we introduce the students and they accept their coats and their degrees. The white coat represents you as a provider and symbolizes an agreement with your patients, an agreement demonstrating your professionalism, truth, and empathy in caring for them. It's a unique relationship, and the coat embodies this. Wearing it carries responsibility and is a great honor. This day marks the beginning of your PA career and the vow to become lifelong learners to serve your patients. As each of you continue on your PA journey, you will now be wearing this long white coat and will be looked upon differently than you did as you were a student. There are greater responsibilities for each of you. These are responsibilities towards your patients, your profession, the healthcare industry in general. We know you will exceed all expectations. Earning this coat was not an easy task, and we would like to share some of that journey with you today. This journey is one you took while wearing your short coat, your student coat. The graduates have successfully completed 4 semesters, or about 15 months, of didactic education. That's many lectures, labs, simulation, service learning, and a few exams along the way. Actually, I asked the class recently, I asked them to kind of give me a final tally of the number of exams in your didactic phase, and after a lot of data analysis, they came up with about 85, so I think that's probably enough, although there is one more, I guess. So while wearing these student coats, they provided service hours throughout the didactic curriculum. This is designed to enrich their student experience and help them reflect on their approach to medicine and diverse patient populations, and to continue this throughout their professional career as a PA. The class of 22 provided 883 hours of service work during their didactic phase of the program. They served in various settings, including the Dream Center of Columbus, serving the homeless, Lifetown, which is an organization working with children with different abilities, and the Columbus Free Clinic, serving those in great need of health care. We couldn't expect more. We're amazed at what these students were able to accomplish, committed to the mission of serving others, all while maintaining the heavy course load that PA school demands. I'd also like to recognize the hard work they've done in this past year as clinical students in the clinical year. While wearing their student coats, each student completed 11 one-month rotations, serving patients in different areas of practice, which in itself can be challenging. Think about getting a new job every month, right? I don't have to tell you. They completed clinical rotations throughout Ohio, the greater Columbus area, and other states as well. While wearing their student coats, the class of 22 saw over 73,000 patient encounters, about 73,782 if your logs are accurate, right? And totaling over 32,000 hours spent with the patient. That's a lot. These were patient visits in multiple areas, multiple specialties: emergency medicine, family medicine, internal medicine, peds, women's health, surgery, behavioral health, and many other specialty areas. This is just a glimpse of what these students have done, and while wearing their ODU coats as PA students in the clinical year in just 11 months. We're so proud of the knowledge and skills of these students and what they possess and how they've been able to share that with their community and all they've done in a short amount of time. However, this is just as important as their integrity and professionalism they have demonstrated throughout the program. I'd like to thank you and give you all a round of applause for these accomplishments. So this is a favorite day amongst us, the faculty, the students, the university, family and supporters. The ceremony is about you, the graduates, sharing your experiences and the outlook on your future. We ask the graduates to reflect on their time in PA school regarding their coursework, their memorable moments, where they plan to practice, what are some advice they have for oncoming, classes, and we're going to get to share their own words as we walk across the stage to receive their coats and diplomas. This is an opportunity for all of us to enjoy their thoughts and experiences and what they have gone through together. It's a celebration written by the students for the students. The white coat will be placed on each graduate by individuals who believe in their abilities and share in their passion for healthcare. In addition to faculty, we have some family members and friends from the healthcare field and beyond that are here to coat their graduates, and today we celebrate each of you. At this time, I'd like to introduce Shauna Ridlinger, Acting Vice President for Academic Affairs, and you're the Class of 2022 PA Program Director. Professor Ridlinger has been the leader of our team for 10 years and a friend and colleague of mine for over 20. This program wouldn't be the same without her vision, her tireless efforts. Although she's transitioned to university leadership, she will always be part of our team. I invite Shauna to address your class and present the candidates for a conferral degree.
Hi there. Thank you so much. The opportunity to be here with all of you today, I'm just so honored to be a part of this still. So honored to have been your program director for most of your time here for the first 26 months. But as I told Cam the other day, the last month is the most fun for you. So, but I'm so happy to be here today. It's my privilege and an honor, truly. I just had a couple things I wanted to say before we move on with the program. First of all, one of the things I frequently will comment on is that we really try to bring the right students here to ODU, the right students for our PA program, with our goal to keep you here, to help you meet your goals, and to move on in your path. And that's what today is all about, celebrating the accomplishments that you've had here and getting a light to see what you're going to be doing after here. So we're pretty excited for you. And the other thing that I often say, as Cameron already also alluded to, is we also have the right faculty and the right team here. We feel very confident in our program and as it's evolved over the years. And I can tell you these people up here, the best. And many of them have been here for 10 years or almost that amount of time. And I can't tell you, I thank you all so much for sharing this journey with me and sharing your time with me. Day in and day out for 10 years is a lot, and we're very, very grateful. So I just want to thank all of them, too. So thank you. Your unrelenting efforts really make these students better, makes your time better. And so many of the things that you reflect on that you've enjoyed about this program are because of the people in this room. So that's really awesome. So at this time, I would like to say to all of you, class of 2022, cohort 9, as we always still say, it helps us to keep that in line, is that I thank you. I thank you for trusting our process. We say that often too, because it's true. But your class came in, as you mentioned, in kind of a whole new situation. And coming in with being in pods and all the things that we all were doing in the fall of 20. But you didn't miss a step. Maybe that some of those songs that you listened to helped your stride for sure. But you didn't miss a step, and you worked together, and this team and you together still did PA school. We did it the best that we could. And we appreciate all your efforts for that, and it shows for where you are to now. So we make it work because that's what we do. That's just the bottom line. That's what we do, okay? You are resilient, and I'll say my last thoughts to you are that remember to be courageous, be kind, okay? And to remember that your patients are not always having their best day, as Connie mentioned. And you are a big source for them, and you're being trained to be able to do those great things. So remember, if you need to get back in touch with yourself, watch that Cleveland Clinic empathy video that I always promote. You don't pay me for that either, but it's so great on empathy. I encourage any of you to Google that. It's a great exercise in reminding ourselves that every day we all have struggles in our journey. We don't know what they are, but being kind, being true to ourselves, and just really giving it your best. All patients deserve our best all the time. Makes all the difference. So thank you. Thank you for this opportunity to say those words. Thank you. So lastly, you have no limits because of this great education. So let's celebrate that now. Let's transition to that. So let's celebrate this great accomplishment. with giving you your diplomas. At this time, would President Gallagher please join the podium with me? I'm just going to scroll down here a little bit. Will the candidates for the degree of Master of Science please rise? President Gallagher, I have the honor to present the candidates that have completed the requirements for the degree of Master of Science. In the name of the faculty, I recommend these candidates be awarded the appropriate degree.
By the authority vested in me through the Board of Trustees as President of Ohio Dominican University, I do hereby confer on these candidates the degree of Master of Science. Congratulations.
Right. You can be seated except for the first row. To begin the coding, will the first row of graduates please stand and approach the stage? Announcing our first group of graduates is Dr. Nicole Powell, Assistant Professor and Associate Program Director of the PA program.
Thank you, fine sir. There it is.
All right, I'm going to digress one last time. Just to tell you, when you walked into Peace Hall, I told you you were an exceptional class, and you truly are. This is our exceptional class of 2022, and I am so excited to announce your names, some of you, as you walk across the stage and get your white coat, your long white coat. Our first from the class of 2022 is Hari Adhikari from Reynoldsburg, Ohio. He has a Bachelor of Science in Biobehavioral Health from the Penn State University in Pennsylvania. He would love to go back to Sim Lab again, which I know most of you would love to do with Professor Brownstein and Professor Kravitz. His most memorable moment is meeting new classmates during the first day of orientation and becoming such good friends with all of you. The support of his fellow classmates and or faculty basically have helped him to successfully complete this program at ODU. His thoughts regarding PA school before starting and now as he's finishing. He thought PA school was difficult to get in, and indeed it's really competitive. It requires hard work and dedication to complete the rigorous journey for 27 months. Do you have them hold their applause to the end? Should I have them hold their applause to the end? No. Okay. The next student is Martha Aguila from Guadalajara, Mexico. She has a medical degree from the University de Guadalajara and previous to PA school, a BS in nutrition from Ohio State. Her husband, Dr. Fernando Aguila, is coding her. She would love to go back and have a few more lectures with Dr. B, as well as Dr. Brownstein in cardiology. Her best patient experience: before removing an epidermoidal cyst, she asked the patient to name it, and after removing it, they actually hugged her. The support of all of you, her fellow classmates and the faculty, helped her to study harder and to enjoy the classes during pandemic times. Although she plans on working in surgery or in the ER, although she wants to have her private Latin urgent care. Next up is Catherine Aliff from Dublin, Ohio. She has a Bachelor of Science in Health Sciences in Rehabilitation from The Ohio State University. Her mother, Charlene Aliff, who is a nurse manager, will be coding her today. While she was observing an 8-hour observation on a brain malignancy and then seeing the same patient 2 months later on an entirely different rotation, completely healthy, that was one of her most significant moments throughout the clinical year. It was absolutely amazing. And again, she thanks all of you to help her gain confidence in her knowledge and her abilities. She's hoping to practice in the SICU. Her hope is that the profession continues to grow and that the knowledge of the profession grows along with it. Her advice to cohorts that come after her: make a study schedule and stick to it, but never sacrifice sleep. That goes true for practice as well. Next is Stacy Ray Allen from Cincinnati, Ohio. She has a Bachelor of Science in Health and Rehabilitation from The Ohio State University. She would love to go back and learn how to read x-rays again. She would love to do radiology and diagnostic methods. Professor Kravitz, you have to invite her back in. Her best patient experience, memorable moment was walking into a patient's room and immediately noticing the signs of a stroke. And she is grateful for all of us here to helping her trust herself and have more confidence in becoming a practitioner. She plans to practice in emergency medicine, and she hopes to always be learning new medical advances and contributing to the PA profession. She basically thought while she was coming in, and now that she's leaving, there's lots of laughs and lots of tears, but guess what, guys? We made it. Hannah Amon from Cincinnati, Ohio, has a Bachelor of Science in Health Sciences from The Ohio State University. And her most memorable moment, she loved getting to rotate in the NICU where she used to work as a PCA. The support of all of us has helped her to feel confident in her knowledge and abilities. She plans to start her career as an emergency medicine PA, and she looks forward to continuing to learn each day. What she would tell future cohorts, PA school is the fastest and slowest 2 years. Make sure to enjoy it and also take time for yourselves as much as you can. Zach Andor from Wheaton, Illinois. He has a Bachelor of Science in Engineering from Purdue University in Indiana. He would love to go back and get after it in anatomy. I added that. I ad-libbed. Just saying, Alicia, ad-libbed that one. Best patient experience, inpatient oncology at OSU with inpatient chemotherapy and cytokine release syndrome with a code. That was his best patient or most interesting patient experience. He said cytokines, I had to mention it. And he would like to eventually practice in outpatient oncology or outpatient family medicine with an outlook that PAs have no bounds and we could do whatever we put our minds to. What he would say to future classes, don't worry about where you will be or how you are doing compared to others. Just find your own way and make sure to pass the courses. Good advice. Jenna Burlett from Columbus, Ohio. Her father, Dr. Greg Burlett, is coding her. She has a Bachelor of Science in Exercise Science from Elon University in North Carolina. Her best patient experience, on her first day of general surgery rotation, she had a patient that was emergently referred to them after going to the ER for constipation and a CT scan showing blockage consistent with colon cancer. She was able to be with him throughout the entire care plan, from pre-op discussions to emergent weekend surgery to post-op and follow-up visits with him and his wife. She was given the opportunity to first assist in his surgery, which was her first experience, and everyone in the operating room was amazing. Were amazing teachers and walked her through the whole process as it was happening. Afterwards, it was amazing watching him heal, get back to his normal life, and she loved being able to give him the good news that no chemo or radiation was necessary. The support of all of us has helped her to push herself to become a better practitioner and take pride in caring for others. Nicole Blevins from Upper Arlington, Ohio. Her cousin, Dr. Amanda Cooper, will be coding her today. She has a Bachelor of Science in Exercise Science from The Ohio State University. And if she absolutely had to choose to go back and repeat a class, I know you all would love to go back and repeat the entire didactic year, it would be with Dr. B, sim lab with Professor B, and class with Dr. B. Most memorable moment was with discussing with the patient and her husband what her symptoms could possibly mean, and then they requested that I always be their provider. Or a hand-tying race in surgery with a general surgery resident and almost winning. That was her other favorite moment in PA school. She's currently undecided, but she plans to pursue a career in surgical, subspecialty, or acute care. She hopes that in the near future she will be in a position to precept future PAs and possibly one day teach in a more formal capacity. Taylor Birch from Orchard Park, New York, has a BS in biology from the University of Dayton, Ohio. The support of her fellow classmates and all of us has helped her to be as successful as a PA student while still being able to find time to smile, laugh, and do the things that she enjoys the most despite the everyday stress that comes with PA school. Her thoughts regarding coming here and then now as she finishes. Before, scared of the unknown, nervous about how to adapt to the fast-paced, rigorous learning, and excited to become a PA. After, proud of overcoming all of the challenges, thankful for new friends and experiences, and excited to start her career as an official PA. She plans to practice in emergency medicine, and as she is excited for the continued growth, expansion, and utilization of PAs into all corners of the healthcare field. Colin Borsch from Potsdam, New York, has a Bachelor in Arts in Biology from Carleton College. He would love to go back and do human anatomy cadaver lab again. His most memorable moment was watching a hemicraniotomy with the intent to relieve pressure from a subdural hemorrhage. The support of all of us has helped him to survive. His thoughts regarding school before and now after: he expected it to be hard but worth it, and it was hard but worth it. He is planning to practice in urgent care or surgery. The outlook appears to be a path with many options and opportunities for new experiences and growth. Some advice for cohorts to come: keep your priorities straight, keep at it, and don't sacrifice too much sleep if it isn't necessary to do so. Would the next row of students please stand and approach the stage? Our first is Hannah Breitner from Carleton, Michigan. She has a degree in a Bachelor of Science in Exercise Science from the University of Toledo in Ohio. She would love to go back and duck those questions from Dr. Weinstock in clinical decisions. Her most memorable moment was designing and conducting the trauma simulation case. It was so much fun to work with her friends along with Professor B on designing the case. We all had so much fun, especially when it came to dressing up for the case. In particular, Margie. The support of all of us helped her to stay sane throughout these last 2 years, along with having faith in herself. She plans to start with the Ohio Health Fellowship for Acute Care in January, with hopes to work in intensive care after completion for the fellowship. Next, we have Morgan Connor from Olmsted Falls, Ohio. Her grandmother, Doris Wilt, who is a nurse, will be coding her. She has a Bachelor of Science in Health Sciences from Cleveland State University. Her favorite class, Med Flight, flew their helicopter onto the practice soccer field, and they talked with us about critical care transport. She plans on starting out in the emergency department and eventually specializing in pediatric gastroenterology. She will be practicing in Cleveland, Ohio. Later into her career, she would also love to precept PA students. Some advice for cohorts that come after her: every day in your clinical rotations is an interview, and you don't have to be the smartest student to make a good impression. Asking questions, showing you're interested, and having good work ethic will take you far. Kaylee Crago from Monroe, Wisconsin, a Bachelor of Arts in Athletic Training from Carthage College, and she would also love to go back and take anatomy and experience the cadaver lab again. Her most memorable moments are any day in the urgent care in Mansfield. The support of all of us has helped her to make it through. She plans to practice in orthopedics or emergency medicine, and as for advice to cohorts that come after her: stay humble, but be confident. Next is Michael DiVenescia, hometown from Olney, Illinois. His dad, Dr. Luis DiVenescia, is a physician, and he's going to be coding him. He has a Bachelor of Science in Interdisciplinary Health from the University of Illinois Urbana-Champaign. His best patient experience: the patient said, "I'm going to be a good provider," to him, of course, not that the patient was going to be a good provider. I read that a little wrong. It made him feel warm and fuzzy. Let's hope that his patient will be right. When asked about the support of all of us, he said that we all helped him to survive school. He plans to practice in something in primary care and perhaps maybe travel a bit. Some advice for future cohorts: be nice and ask lots of questions. Next is Giovanna Di Loretto from Canton, Ohio. She has a Bachelor of Science in Health and Rehabilitation Sciences from the Ohio State University. She'd love to go back and do pharmacology again because it gave her a great foundation of the relationship between drugs and disorders within human body systems. Treating disease is her favorite part of medicine, and this class helped prepare her so well. The support of her fellow classmates and faculty helped her to survive PA school the past 2.5 years. The many nights of studying and all of the exams are so much better when you're not alone and with people who understand what you're going through. In January, she will be working at Apex Dermatology in Northeast Ohio, doing medical, cosmetic, and surgical dermatology. She believes that our profession will continue to have tremendous growth and advancements over our generation of providers. Next is Madison Gareth from Newcastle, Indiana. Her sister, Mackenzie Gareth, who is a physical therapist, will be coding her. She has a Bachelor of Science in Biology from Ball State University. She would love to go back to PD Lab because it is where we got to know some of our classmates a little better and started learning how to apply textbook medicine to real-life scenarios. She plans to practice in orthopedic surgery, and as for advice to cohorts to come, this will be one of the hardest things you've ever done, but will also be the best. You will create amazing lifelong relationships with some of your classmates, and you will see, even as a student, you have an impact on patients' lives. All of the long days of lecture, followed by full nights and weekends of studying, will be worth it. Next is Michelle Greider from Indian Lake, Ohio. She has a Bachelor of Science in Human Life Science from Indiana University, East Indiana. Her most memorable moment was creating trauma sim lab cases and meeting new people every month in rotations. She plans to practice in either family medicine or dermatology, and her outlook is that PAs are going to continue to grow in number and in their scope of practice. Her advice for those that come after her: it is hard to see the big picture and end goal at times, and her advice is to be present and to trust the process. Alyssa Hastings from Lewis Center, Ohio. Her mother, Julie Mast, who is a PT, and her father, David Mast, who is a perfusionist, will be coding her. She has a Bachelor of Science in Exercise Physiology from Ohio Dominican University. She would love to attend her behavioral health lectures again. Not only is psychology a major interest of hers, the class was full of intriguing stories and presented information in a concise manner. The frequent donuts were also a plus. The support of all of us have helped her to tackle PA school head-on and pushed her to finish strong. She plans to start in primary care and later pursue a fellowship to allow her to specialize in psychiatry. Advice and comments for those that come after her. PA school, many of us are type A overachievers who always seek to put our best foot forward. This is a valuable skill to possess. Look how far it has gotten us. However, I believe being a provider requires a certain level of humility. We have learned a lot over our last 2 years, but medicine is vast, and we can never know everything. Listen to your patient, listen to your patient, own and learn from your mistakes, and never stop being a student of medicine. Tyler Hedrick from Mount Vernon, Ohio, has a Bachelor of Science in Biology from Olivet Nazarene University, and he would love to go back to PD Lab and skills. They were always a lot of fun and very helpful in his clinical year. His best patient experience was helping bring life into the world during his women's health rotation. The support of all of us has helped him survive and stay sane. He plans to practice in orthopedic surgery, possibly in the military. His thoughts regarding PA school before starting and now as he's graduating: difficult, trying, extremely challenging, but absolutely doable if you surround yourself with those who want to see you succeed. Bradley Hefner from Sterling Heights, Michigan. His brother, Alex Hefner, who is a doctor in physical therapy, will be coding him. He would love to go back to anatomy to talk with Dr. Nelson again. His memorable moment was COVID abruptly interrupting in-person learning and having to adjust to online PA school. The support of all of us has helped him to ease the transition of taking a year off of PA school and returning with Cohort 9. He plans to practice in internal medicine and is excited for the numerous opportunities that come with being a PA. Announcing our next group of students is Professor Maria Gluis, Assistant Professor and Academic Coordinator for the PA program. Row 3.
First student is Peyton Hurl, hometown of Pataskala, Ohio, and she will be coded by her sister, Taylor Rathbun, also a physician assistant. Peyton has a degree of Bachelor of Science in Biology from Wittenberg University. When asked what lecture or class she would like to do again, any of the sim labs, cadaver lab, physical diagnosis lab. And Peyton plans to practice in emergency medicine. As for the PA profession, she said, I think it will continue to grow and gain rapport and respect, and I'm proud to be joining this profession. Her advice and comments for the cohorts that come after: my advice to future cohorts would be to take things one day at a time, trust your abilities, as well as to always find time for yourself. Jenna Jacobs from Dublin, Ohio, will be coded by her mom, Janet Jacobs, who is an RN. Jenna has a BS in cellular and molecular biology from the University of Michigan. Her best patient experience: she had a great experience in the ER rotation when a pregnant female came in complaining of abdominal pain and was fearful that she was having a miscarriage. After confirmatory testing, I was able to report back to her, speaking Spanish, that she was not having a miscarriage. She was actually having twins. It was a great experience to be able to put her mind at ease and instead report such happy, exciting news. Jenna plans to practice in dermatology after graduation and is excited for the future of the PA profession. Throughout clinicals, I was able to see PAs thrive in all areas of medicine, and I feel the profession will only continue to grow in size and impact throughout Ohio and the country. Lucy Johnson from Sugar Grove, Ohio, has a bachelor's degree in human biology and psychology from Ohio University. When asked what lecture or class she would like to do again, she chose clinical decisions class. Her most memorable moment: the first time being handed the instruments to take charge on a procedure, was both exciting and terrifying. Her advice and comments for the cohorts that come after: just keep swimming and placing your faith in Jesus. Lucy Keyaha from Columbus, Ohio. She has a BS in health sciences from Ohio State University. When asked what class she would do again, she chose skills lab with Professor Powell. Her most memorable moment was seeing Professor Ridlinger at the Harry Styles concert in Cleveland the night before the orthopedic surgery exam. Her thoughts regarding PA school before and after: no matter what you think of it beforehand, there were so many new challenges that we had to learn to adapt and how to be flexible. Looking back, it feels like such an accomplishment to finally be at this point. Her advice to the cohorts after: all your hard work is worth it in the end. Madeline Keel from Cincinnati, Ohio, has a BS in neuroscience from the Ohio State University. Her best patient experience was seeing my patient the morning he was told that he would be receiving new lungs. The support of her fellow classmates helped her to stay informed and supported. Even when classes were partly remote, I always felt like part of a community. She plans to practice in an emergency department setting and is excited to see PAs utilized more across all healthcare fields. Her advice and comments to those that come after: trust the skills and intelligence that got you here. Never be afraid to ask questions, and make sure you take time for yourself. Bethany Koenig from Tip City, Ohio, has a BS in Allied Health from Otterbein University, Ohio. Her best patient experience: I saw a patient in urgent care who cut his cheek cutting down branches in a yard. I was able to remove the wood debris from the wound, close the laceration using 5 sutures. A few days later, a nurse at the urgent care showed me the company's review page and that the patient had gone online and left a 5-star review of the practice and mentioned me by name. He said I provided excellent care, was very kind and helpful to him. I saw the patient a week later when he returned to get his sutures removed. He immediately recognized me, remembered my name, and told me how happy he was with how his laceration healed. He thanked me again and told me how much my kindness that day had impacted him. Hannah Konsulik from Lake Orion, Michigan, has a Bachelor's of Science in Nutrition Science from Bowling Green. Her uncle, John Konsulik, will be coding her. He's an anesthesiology physician who has always encouraged and helped her along her path to PA school. She said, I was lucky enough to live with him in Florida during my internal medicine rotation, and I learned so much from him. Thank you, UJ. Her thoughts regarding PA school before starting and now as she's finishing. Reflecting back from August 2020 to now, the PA program at ODU has helped me to realize that being a PA isn't always about the medicine, but the actual encounter you have with a patient. We truly can impact a patient's life. It comes with immense responsibility, but is such a privilege. She hopes to practice in either dermatology or emergency medicine. The impact we can make on patients and healthcare realm is growing rapidly, and I'm so excited to be a part of the PA profession and see where my future goes. Rachel Leonard from Hendersonville, Tennessee. Rachel is being coded by her uncle, Pat McCurdy, an ODU Board of Trustees member. Rachel has a BS in biology from St. Mary's College of Notre Dame, Indiana. Her best patient experience was being able to be part of a first-time mom's experience of the month leading up to giving birth, the delivery of the baby, and the joy of being able to be involved in such a pivotal time in a patient's life was so rewarding. Advice for the cohorts after: use difficult experiences to help you become a better provider and person. There will always be opportunity for growth, both personally and professionally. Griffin Longley from Almont, Michigan will be coded by his wife, Faith Longley, who's a registered nurse at The Ohio State University. Griffin has a BS in biochemistry and molecular cell biology from Bethel University, Indiana. The lecture or class that he would like to go back and do again is SimLab. His most memorable moment was first assisting the surgeon placing a patient on bypass machine during his cardiothoracic surgery rotation. The support of his fellow classmates and faculty helped him to reach the finish line, and he would eventually like to work in cardiothoracic surgery. His advice for the cohorts after: it takes a long time, but it goes by fast. Jennifer Lyons from Westerville, Ohio, is being coded by her best friend, Janelle Painter, who is a physical therapist. Jennifer has an MS in exercise physiology from Ohio University. Her favorite patient experience while in PA school was during her trauma rotation. I was part of a team that helped a young patient recover from a car accident that resulted in an amputation. This patient taught me so much about courage and determination and why maintaining the human element of medicine is so important. Her thoughts regarding PA school before and after: working in the medical field for many years prior to starting PA school, I found myself often wishing I could advocate for patients on a higher level. I knew returning to school was the answer. As an older student with a family, I knew it would be hard, but I felt up for the challenge. And now that I'm finishing, I am so happy I listened to my heart, and I'm excited for my future. For row 4, we have Sarah Marshall from Dublin, Ohio, has a BS in Human Health Sciences from the University of Kentucky. Her most memorable experience in clinical year was delivering a baby. The support of her fellow classmates and faculty helped her to stay sane with the many, many, many exams that we had. Her thoughts regarding PA school before and after: I thought my social life was going to be over. And don't get me wrong, there were days and weeks where all anyone did was grind away at school, but there were just as many days filled with sand volleyball, cookouts, pool days, and I have made some lifelong friends. She'll be moving to Lexington, Kentucky to start her career. Brenna O'Connor from Chicago, Illinois. Brenna has a bachelor in exercise science from University of Toledo, Ohio. Her best experience occurred during the 8th Skippy. I was able to follow my patient from weekly checkups in her last weeks of pregnancy to spending hours encouraging her during the labor process, and ultimately I helped her deliver her baby. Her thoughts regarding PA school before and after: the thought of PA school was very intimidating, especially not knowing what to expect during COVID. Now that I'm finishing, this experience goes to show that you can adapt and accomplish the most intimidating things by showing up and putting in the work. She plans to practice in neurosurgery and is excited to see the growth of the PA profession and knows that we will all accomplish amazing things. Her advice: take it one day at a time, have a positive attitude, and that makes all the difference. Palalai from Elizabethtown, Kentucky. She's being coded by her Aunt Casey Palalai, who is a PA. She has a Master's of Public Health from the University of Cincinnati. She would like to go back and do simulation lab with her favorite Professor Brownstein. I especially enjoyed the student-led trauma case that I got to create and lead with my friends. The support of her fellow classmates and faculty helped her to feel most supported when she was at her weakest with a torn Achilles. Faculty and friends stepped up to ensure I always had notes, resources that I needed, and drive me to and from class and lab, and carried my bag when I needed to crutch or scoot around. She loves being in the OR and is excited to start her PA career in an orthopedic surgery position. And her comments for the future, one of my favorite preceptors consistently reminded me to give myself grace. PA school is hard. We all make mistakes and get questions incorrect, but every experience is an opportunity to grow. Emma Romine from Marysville, Ohio. She has a BS in biology and exercise science from Ohio Dominican University. The class and lecture that she would like to go back and do again are both diagnostic methods and clinical decisions. Her most memorable moment is when she found excitement in an area of medicine that she didn't necessarily see herself liking or working in. Her thoughts before and after school: it's not just about understanding the textbook content to provide great healthcare for patients. I appreciated getting to learn firsthand how to interact and empathize with patients. She plans to practice in family practice or acute care, and her outlook on the PA profession is that it's ever growing and there are still areas for improvement on how to best utilize PAs. Shelby Schotten from Marion, Illinois, has a BS in exercise science from Ohio Dominican University. If she could go back and repeat a class, it would be anatomy. She plans to practice at Riverside Hospital in the trauma department. Her thoughts regarding PA school before and after: it went by even faster than everyone said it would. Her comments for the cohort after: clinical year makes the pain of didactic worth it. Trust the process and keep going. Alicia Simpson from Columbus, Ohio. Alicia has a Bachelor of Health and Rehabilitation Science from The Ohio State University. If she could go back and do another class again, it would be physical diagnosis and SimLab. The area that she plans to practice in: she has accepted a job with Mid-Ohio Emergency Services in the emergency department, and she plans to work in the ED as long as it remains a passion of hers. She would also like eventually to dabble in healthcare policy. Her advice and comments for the cohorts that come after: everybody comes out alive. Just form good study habits and boundaries early on, and never forget that you earned your spot and you deserve to be here. Lindsay Smith from Grandview Heights, Ohio. Lindsay has a BS in health sciences with a minor in biology from The Ohio State University. Her thoughts regarding PA school: before starting, I had a lot of apprehension about what to expect and how difficult the courses would be. I think after finishing, I've realized how great our professors are and how everyone in the program really is there to help you succeed and get through the difficult classroom material. I look forward to entering the field as a PA. Her advice and comments: make friendships with your classmates. It is what will help you get through the hard times of school. Some days are harder than others, but in the end, it is all worth the hard work and the time spent studying. Anna Stackler from Bloomfield Hills, Michigan. She'll be coded by her father, Robert Stackler, who is a physician. Anna has a BS in pre-medicine from the University of Dayton. The support of her fellow classmates and faculty helped me to expand my education and challenged me to become the best healthcare provider possible. Her thoughts regarding school: over the course of PA school, I've learned that the importance of people skills and interacting with others in a sensitive healthcare environment is one of the most valuable qualities we can possess as a PA. She plans to practice in a surgery subspecialty, and her advice is quality studying over quantity. Make time for yourself and have fun. It goes by quickly. Olivia Speck from Avon, Ohio. Olivia has a BS in biology from The Ohio State University. If she could go back and do a class again, it would be pharmacology. The support of her fellow classmates helped her to get through every semester of PA school. She plans to practice in family medicine and cannot wait to make a change in patients' lives. And her advice for the next cohort is to remember why you want to be a PA and be confident in your knowledge and skills as you go through school. Announcing our final group of students is Professor Erin Fenzel, Assistant Professor and Clinical Coordinator for the PA program.
Brooke Thompson. Brooke is from Jefferson City, Missouri. She has a BS in Health Sciences with a minor in Sociology from Bradley University in Peoria, Illinois. She's being coded today by her mother, Gail Thompson, who is a nurse. She would like to go back and do behavioral health again because Tiffany always brought in Krispy Kreme donuts, especially after exam days. Her best patient experience occurred during her rotation with COPC Senior Select. There was an elderly female patient who always came in to the activities that the clinic put on. She had no children, no spouse, and no family still living. It was her birthday one day, and we serenaded her and had cupcakes for her when she walked in the building. We were some of the only people that she knew that it was her birthday. We wished her a happy birthday that day. The office went above and beyond for that patient, and it was a very moving moment. Her thoughts on PA school is that she was naive about how challenging it would be, the hours of studying, the number of exams, and the weight of always striving for the best score. Brooke Thornton, she's from Roanoke, Virginia. She has a BS in biology from Cleveland State University. The lecture or class she would like to go back to is clinical medicine, especially the renal lecture, because who really knows what the kidneys do anyway? The support of her fellow classmates and faculty helped her to enjoy her time throughout PA school and to make wonderful memories. Her thoughts regarding PA school: at the beginning, I knew it was going to be a lot of work, but now I know that it was all worth it to make it here and to be starting a career in a field that I love. She plans to practice in acute care, and her best advice is what she was given during her clinical year. Always be willing to admit what you don't know and then go learn more about it. McKenna Vento is from Heartland, Wisconsin. McKenna has a BS in Health Sciences from Cleveland State University. The lecture or class she would like to go back and do again is PD Lab. Her most memorable moment was designing the trauma case for her class. Her thoughts regarding PA school: before PA school, I was scared about all the unknown and starting in the middle of a pandemic. But now I feel confident in my learning and can't wait to use my skills in practice. Time really flew by. She will be practicing in emergency medicine, and her comments for future cohorts are: dedicate yourself to studying, working hard, but don't be afraid to enjoy times with your friends and family. Andrew Wayman. Andrew is from Wapakoneta, Ohio. He has a BS in biology from Ohio Dominican University. Today, he will be coded by his sister, Allie, who is a nurse. The lecture or class he would like to go back and do again is diagnostic methods. His best patient experience was spending an hour and a half sewing up a guy's mangled hand in the ER after a table saw accident. Quote, "It provided great bonding time, and yes, the finished product looked wonderful, if I do say so myself." The support of his fellow classmates and faculty helped him to stay focused on reaching the finish line. His thoughts regarding PA school: before, would be difficult. After, was difficult. He plans to practice in acute pediatric care. Advice for future cohorts: pray. Kelsey Williams. Kelsey is from Zanesville, Ohio. She has a BS in biology from Ohio University. The lecture or class she would like to go back and do again is clinical skills. Her best patient experience: no certain moment or experience was my favorite because she enjoyed it all. The support of her fellow classmates and faculty helped her to survive PA school. Her thoughts regarding PA school: I knew PA school would be tough coming into it, but as I'm finishing and reflecting, it was the hardest 2 years of my life, but also the most enjoyable 2 years. I made many new friends and colleagues while learning how to help and serve others. She plans to practice in primary care. Drew Willman. Drew is from Sydney, Ohio. He has a Bachelor's of Applied Health Science from Bowling Green State University. He's coded today by his mother, Rhonda, who is an RN. The lecture or class he would like to go back and do again is clinical decisions with Dr. Weinstock. His best patient experience was when he got to touch a live beating heart in his cardiothoracic surgery rotation. The support of his fellow classmates and faculty helped him to stay focused on the end goal and enjoy the much-needed time off. Thoughts regarding PA school? I had no idea what I was getting myself into. This program has been the most challenging task I have ever taken on. Through the peaks and valleys of the struggle, I discovered aspects of myself I would never have known without having gone through it. His advice for future cohorts: don't try to do it all by yourself. Every exam is not life or death. Take moments to recognize how far you've come. Keep going, the tough times will pass. Justin Wright. Justin is from Hilliard, Ohio. He has a BS in athletic training from Ohio State University. He would also like to repeat Dr. Weinstock's class. His best patient experience was helping to deliver a baby during his women's health rotation, and the father passed out. The support of his fellow classmates and faculty helped him to become the best PA possible. His thoughts regarding PA school: they said it was hard and expensive, and boy, they were right. He is looking to start in the ED after graduation, and his advice for future cohorts is to prepare to grind during the didactic year. But once you get into clinicals, it's more fun and less of a constant stress. Caitlin Yatson. Caitlin is from Strongsville, Ohio. She has a BS in psychology from the Ohio State University. The lecture or class she would like to go back and do again is genetics. Her best patient experience was helping to deliver babies during her OB rotation. With the support of her fellow classmates and faculty, it helped her to become more confident in herself. Her thoughts regarding PA school: now, as I am finishing PA school, I've realized the scope of what PAs are capable in healthcare, education, and the community is even broader than what I had imagined, and I'm even more excited to be part of such a multifaceted and growing profession. She would like to practice in pediatrics, family medicine, or women's health, and her outlook for the profession is that it will continue to evolve and become even more versatile and valuable than it is already. She's eager to see what the future holds. We also have two students that were not able to join us in person today, and they are remote, so I'm going to read about those students. The first is Shannon Morse. Shannon is from Lake Odessa, Michigan. She has a BS in biology from Cornerstone University in Grand Rapids, Michigan. Her most memorable moment was when the patient thanked her for being kind and taking the time to listen to their concerns. This reinforced to her the importance of treating and caring for the whole person and not solely their presenting complaint. With the support of her fellow classmates and faculty, it helped her to focus on the big picture of gaining the skills and knowledge to become a compassionate provider and not to get caught up stressing about all the small stuff. The next is Hannah Razi. Hannah is from Toledo, Ohio. She has a BS in exercise science from the University of Toledo. The class or lecture she would like to go back and do again is dermatology lecture with Chris, the derm PA. Her most memorable moment through the clinical year was getting to be first assist in an ankle ligament reconstruction surgery, the same surgery that she had undergone while in high school with the same surgeon that sparked her interest in the medical field 10 years ago. The support of her fellow classmates and faculty helped her to continue in the program throughout her pregnancy and the birth of her son, while still feeling confident in herself as a student, mother, and a future PA.
We're close. Well, what great experiences they've had. It's always exciting to kind of hear their stories and what stood out to them and to kind of let them kind of guide this ceremony. So thank you for sharing. So this is just a small sample of the impact that you've already had in the community, right, for the past 11 months. I'm excited to see what's going to be next with their whole career as a PA. If you would now stand and refer to your programs, graduates, stand. Refer to your for the PA oath on the back of your programs. So this is the same oath that you took your very first semester with Professor Ridlinger in your PA Professions class. As the white coat symbolizes that you vow to provide compassionate patient care, I now ask you to recite the PA oath that will define each patient as an individual and pledge to keep the patient's best interest at heart to provide high-quality patient care throughout your careers. Ready? All right, so we'll start with I pledge. I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my medical knowledge, skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care for patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor. I present to you ODU PA Class of 2022. You can sit. So as we close today, I'd like to thank all of you again for your commitment and support to our graduates. Thank you for coming today. I'd like to thank the graduates for your commitment to success throughout your program and this profession. We encourage collaboration amongst our faculty, our students, and we ask for you to do the same in your practice as a PA. We're confident in your abilities to impact our community by serving those seeking care, practicing with compassion, sincerity, and humility. You're entering healthcare at a time when we need you the most to provide high-quality healthcare. We thank you for what you do, for staying the course, and we look forward to seeing your accomplishments. Never forget, you've earned these long white coats through the hard work and care that you provided while wearing your short ones. You will forever be Panthers and are always welcome at ODU. We wish you all the very best.